It's 5:44. We've been looking this week at how 3 years later, COVID-19 continues to shape our lives in business, education, and this morning, a look at how the pandemic reshaped health and healthcare access. COVID-19, 3 years later. Columbus Public Health Commissioner Dr. Mysheika Roberts says she's pleased to see progress, but cautions there is room for improvement.
Now we can test at home in the privacy of your home, but then you had to go to a location, you had to have someone swab you, and then we had to send it away, which took time.
Commissioner Roberts also points out that more people know about public health now than before March of 2020. At that time, she and former Ohio Department of Health Director Dr. Amy Acton were at the epicenter of a public health crisis, a looming pandemic, and the mass gathering of thousands for the Arnold Sports Festival.
I woke up that Monday morning right before the Arnold was supposed to start, and I just had a gut feeling that this was not the right thing to do for our community.
There were no vaccines at the time, no means of mass testing, and Dr. Roberts urged city and state leaders to cancel the sports festival.
Continuing it as planned simply was an unacceptable risk.
Do you have regrets about that?
Absolutely not. It was the best thing we did for our community. I believe strongly that we prevented being on CNN on a regular basis, being the epicenter of a large outbreak in Ohio.
And Dr. Roberts also cites the progress made in moving from mass drive-through testing sites to candid conversations after racism was declared a public health crisis.
I tell this story pretty vocally. The first case that we confirmed here in Columbus was a minority, and they told the story very explicitly that they had to beg to get the test because the people and the healthcare providers were like, I don't think this is COVID yet. They had all the risk factors that we knew about at that time, but they had to beg, and finally they were successful in getting tested.
Dr. Roberts says there is growth in cultural competence, as well as gains from medical experts pushing for science and research and against fear about vaccine effectiveness and disinformation.
We talk in our friend circle, have you been vaccinated? Have you been boosted? When did we ever talk about that before, you know? But now we talk about it, you know, and so I think we have come to a different level. We still have a lot of work to do, though.
And she's so right, because we all talk about it, and whenever somebody sneezes, we all go, oh, no, don't worry, we talk about it. But remember, back in the day, it was very hush-hush.
It was. But that's the silver lining, right? I mean, you have to talk about it, and then it also exposed what, you know, the health disparity gaps that we were dealing with.
And we're starting to see people talk about social determinants of health, like in conversation, like, oh, really? We're talking about that now?
Yeah.
Let's do it.
And it really changed, you know, going to work sick and going to school sick.
Yes.
Because you're like, you never know, and you don't want to get others, you know, it was, you felt responsible for other people's lives.
A layer of compassion out of that. That's really good.